Hi, my name is Sarah Ramsey, and I did my presentation on the top 3 injuries in soccer in college-aged males. And by top 3, I don't mean the most favorite, I mean the most common. Let's get to it. I'm sorry I'm going to be talking super fast because I keep not making it. Okay, so ankle sprains is the most common. There's inversion, eversion, and high ankle sprains. So inversion is the one we're going to be talking about because it's the most common out of the 3. Eversion only makes about 5 to 10%. So it kind of just proves inversion is the most common. When an inversion ankle sprain happens, the anterior talofibular ligament, the posterior talofibular ligament, and the calcaneofibular ligaments are injured and torn or stretched in some way. There's a great video explaining it if you have time to watch it. So there's usually no trauma to the skin or to the bone, usually, depending on the grade. But the ligaments that I previously talked about, they can be torn or strained or internally rotated in a way that they're not supposed to be because they're designed to do a certain thing, and if they are overstretched, then that can be a problem. In soccer, this can usually happen in an uneven field if there is lumps or divots and the athlete steps wrong and it can hurt the ankle, or if there's a ball that's coming fast at the athlete and they stop it with their ankle, but the ankle doesn't have enough support from the ligaments or from muscles, that could also cause a sprain. Or like it could happen as easily as an athlete sets their foot on top of the ball and it slips off and hits the ground funny. There's all sorts of different grades and ways that an ankle sprain can happen, especially in soccer. Then testing it, we have on field, you want to do the anterior drawer test and the Taylor test. This tests for different ligaments as seen, but this will help us to figure out if the ankle was sprained and the severity of the sprain. It is, depending on how bad it is recommended that an x-ray and an MRI is taken to make sure that there's no fractured bones, just to make sure, and there's no torn ligaments. So, like I said, there are 3 grades. Grade 1, there's some swelling. There's point tenderness, which means there's tenderness in one area. There's mild pain. They usually can still weight bear on the ankle, which is great. Grade 2, there starts to be some like watery fluids which is called edema. Tenderness, more general. Moderate pain, the patient will complain of a pop or a snap when the injury first occurs, and weight bearing will be kind of painful. Grade 3, there's definitely swelling. There's severe pain, there's discoloration, you can see it on the outside, and no weight bearing is possible, it just hurts. How to treat it. So grade 1, 2, and 3 all require rice for different amounts of days. So grade 1 is about 2 days, grade 2 is about 3 days, and grade 3 is 2 or more days that you're going to want to rice it. Grade 1, there's not a whole lot to do. It's not very severe. If the patient feels more comfortable, you can give them a, horseshoe pad or elastic wrap, which, may help with their weight bearing. It may be beneficial to keep off the foot, but it's not completely necessary. Grade 2, it is necessary. You'll be on crutches. Athlete will be on crutches for 5 to 10 days, and then it'll be taped, or immobilized, for 1 to 2 weeks after or injury. But we still want to immobilize the talus as soon as possible. This will help prevent, really tight muscles, and it's really important to get that moving, especially with all the swelling. And then the closed basket weave technique is recommended for weight bearing or for walking after that. Grade 3, most require surgery at this point, which means that they're going to be off of it for longer. 3 to 6 weeks, they're going to be in the cast, dorsiflex, and then 3 to 6 weeks after that, taped with crutches. Exercise. So all of these include range of motion and strengthening just at different times. So grade 1s are usually in and out pretty fast. They do range of motion, isometrics, strength training, sports-related activities because it's not injured that bad, and they can go back on with their life. Grade 2 and 3, they will start with isometrics with the foot immobilized, and then they go on to do strength and range of motion and balance, but depending on how severe the injury was, these might take longer to get to as the pain is more severe, or the surgery, they're still trying to recover, and it just might be more painful. So it will take longer. The higher the grade, the longer the therapy will take. There are some preventative and rehabilitative exercises that are possible to do for an ankle injury, and there's some videos that explain a couple. Hamstring strains. Okay, so the thing about the hamstring is that it's 3 different muscles: semitendinosus, semimembranosus, and the biceps femoris. The biceps femoris has 2 heads, the short head and the long head. So a hamstring strain will happen when it's strained beyond the normal capacity in some way, shape, or form. So the theories of how this can happen, there's many different theories. No one really knows for sure what causes a hamstring strain. One of the options is that the quadriceps, which are a really strong muscle, and the biceps femoris of the short head try to contract at the same time, and obviously the biceps femoris loses because it is so much smaller than the entire quadricep. So it will strain that way. Another theory is that the hamstring will try to stabilize the knee while at the same time extending the hip, which can cause strain as it's doing too much at once. There's sudden change in direction, and the muscle weakness and tightness, and there's very many theories. Also, very cool video down below showing a hamstring strain in progress, which I thought was really neat. Okay, so there's no damage to bones at all, but there are different grades. So depending on how many muscle fibers were torn, it depends on the grade. So the muscle for grade 1, it's not usually a whole lot of muscle type fibers torn. It's usually more of like a muscle spasm, where there's stiffness and swelling, tenderness, but that's pretty much it. Grade 2, it's usually half torn or partial torn. There are going to be some loss of function because something just tore in your body and it's not supposed to. There's going to be severe pain and there's swelling. Grade 3, it's going to be torn about half or more. This is extreme pain, extreme swelling. You'll see the bruising on the outside. There's loss of function. And what I thought was really cool is that you can palpate for either a divot or a lump to see if the hamstring was pulled, strained. Really, I thought it was really cool. In soccer specifically, this can happen when quickly changing directions to receive or shoot a ball, or it could just happen because the muscle is too tight and there's too many movements and too much expected out of the muscle, and it gets tired, and it's just not going to work the way it should. So something I thought was interesting was there's a faster recovery time if the injury is mid-leg versus proximal leg. So there's a couple of things you can do to test for a hamstring strain. These exercises that you can see in the picture are things that can be done on the field to test for a hamstring strain. But depending on how bad it is, an MRI is recommended just to see where the injury is, how bad it is surgery needed, how long is physical therapy going to take, all of the things that we need to know as physical therapists. Treatment. No matter what happens, RICE is necessary, as well as anti-inflammatories and painkillers. Those are all required for depending on the grade. The difference is that for grade 1, as soon as the pain is gone, they can return to normal activity. But for grade 2 and grade 3, they require long rising stages as well as physical therapy, but they can't start physical therapy until the inflammation is gone. Grade 3 will have a longer physical therapy, most likely. So, lucky them if they got it, because recovery time is actually pretty quick. It's only about 1 month. They start with isometrics, and then they move to light stretching and jogging and stationary pedaling, and then after that, they move to something like leg curls that puts a lot of weight and strain on the hamstrings, that they're in resistance that it's not used to having, so that happens later on, but it definitely prepares them back for their sport and normal day life. There's some great exercises that I have, preventative and rehabilitative, and some videos explaining 2 of them. Anterior cruciate ligaments. Okay, this is my favorite, and this is why I keep running out of time. This is an ACL tear, and it's usually a sport-ending or career-ending injury because it just takes so long, and it always requires surgery. But yeah, okay, sorry. We're gonna talk about it. So, this happens when the ACL is overstretched due to internal-external rotation of the knee, and there's a great video explaining it. When it first happens, the athlete will feel a snap or a pop. They will probably immediately drop to the ground. Swelling is within 2 hours, and the knee will feel very unstable. It'll be very painful. Most ACL tears happen in non-contact. I think it's 80%, if I'm correct, that happen in non-contact. For soccer players specifically, they could be changing direction really quick with their foot planted on the ground, and it's just, if they're changing directions and their foot's planted, they couldn't be turning their whole body, and it's just, never mind, it's painful. Or they could be running and trying to kick in a lateral direction to their body, and their entire body changes direction, and it's just too much for the ACL to be able to hold on to that much force and turning at the same time. The injury. So, the ligament can be torn or stretched, but also other things can happen, such as the collateral ligaments or cartilage can also be damaged, so it's really smart to go to the doctors and get an MRI to see what happened exactly. There's this insertion and origin. Assessment on field, you're going to want to do a Latchman's test, anterior drawer test, or pivot shift test. These all test for knee stability, as that's what the ACL does. But definitely recommended to get an X-ray and MRI afterwards to see the severity and what else could have been injured. It's important to test the full range of motion. Okay, treatment. So, immediate rise, because there's immediately swelling. Surgery will be required most likely. It is important to keep rising, and there's going to be, you need to protect the leg for about a week, and then support it for 3 to 5 weeks, and there's a lot of rehab, roughly 2 years until it's fully healed. So week 1 through 4 is a lot, or week 1 through 12 is a lot of strengthening exercises. So start with isometrics, and then 1 week in, we start weight bearing on the knee and doing closed chain kinetics actions to try to prevent closed chain we want the stability and we don't want more injury. That's why. Month 4, they can start to do bonds and functional activities. They might even run a little bit, which is great. Here's the plan. There's a bunch of preventative and rehabilitation exercises. There's a lot more than this. Most will strengthen all the muscles around the ACL to better support the knee now that the ACL is lacking. There's some videos to watch of the exercises. Yes. Okay, so why do these happen? Well, when someone is on turf, there's a lot more traction. If and traction makes it so that the body doesn't turn as naturally, like the foot won't slip and the foot will just stay and the body will turn and it'll tear things and stretch things, and it is not good. Cold weather will make muscles more tight, which makes people more prone to injury. And then also, depending on the athlete's weight, believe it or not, according to physics, they have a harder time stopping or changing direction, and the body keeps wanting to go in that direction, and that can cause injury. For ankle sprains, there is no specific gender as far as who gets injured more with ankle sprains. With hamstring strains, it can be caused from tightness, which actually is more likely to happen in males than females, as a study shows. So in that sense, they're more prone to the injury, if that is the theory that is correct, is tightness causes hamstring strains. It can also happen to muscle fatigue or bad posture or form or imbalance of the strength in the leg, hamstrings to quad ratio. Okay, lastly, ACL tears. It's more likely to happen in females because of their structure, their hip to knee ratio, degrees, their valgus-like structure. They're more likely to happen in non-contact, but can happen in contact, and it happens a lot with overloading or stretching the ACL with closed chained actions and twisting the tibia. So yes, more likely to happen to females. I finished! Okay, and those are my references. Thank you!